It's one thing to have an idea about what is going to happen in the pandemic, and then to see that the anticipated outcomes are actually occurring, especially in relation to mortality. And some data from Denmark, which I've spoken about recently, where for patients who have been admitted to hospital with a COVID diagnosis within 2 weeks of admission, within 30 days, about 1 in 8 of them are dead. These are stark statistics. And this is looking at the vaccinated cohorts. So, this is from Denmark, where 95% of the over 65s are vaccinated. And this is the cohort that seems to be primarily affected. How can we know what is going on? How can we anticipate how we deal with this? And for those people who are wondering about, well, what do I do? I'm trying to think about solutions. One of them is that you can join me in this upcoming webinar with regards to spike detox. Does everyone need one? An important discussion and something that I haven't touched on previously, but it highlights, in fact, the indication that the spike protein is a real problem long term. As I said, I've always said that, but more and more the statistics are supporting what is happening. Now, what I'm trying to do here is, again, I'm trying to move ahead of the science. So, what we're talking about here is a future idea, meaning that this is not yet done, but I have a suspicion that this could be done in order to make some sense and anticipate primarily who is affected. And so I'm going to start with some ideas here. And as you remember, when I speak about the COVID storm, I am talking about a spike triggered autoimmune response mechanism. That's what I call the storm. And in effect, what the storm is that it occurs in people who are having recurring COVID infection on top of immune priming, elephant immune priming. And the combination, based on my prediction, is very, very serious because the presentation of disease is not simply just about severe COVID. Very often, there are mild initial symptoms, but chronic immune activation with ongoing symptoms, sometimes for months in many people. Question then is, how do we address that? What is it that we can do in order to probably try and identify who may be most affected and how can we then deal with it? All of my research is focused around autoimmunity. That means the body attacking itself. And this here is the typical example of what I think autoimmunity is in an image. In effect, you can see this is the same person, but she doesn't recognize who she is in the mirror. And very quickly, she could attack that person in the mirror. And it's very similar with autoimmunity. The immune system normally protects itself from attacking itself. But in situations where there are certain triggers, and I've done a recent course on this, you can then have the body targeting normal tissue. So this is where I'm coming now to the retina, because I'm looking for where can we find answers about where and who is affected. So just some simple basic anatomy here. This is just the human eye, and you can see here, this here is your cornea. This is clear, so the light will come in through here, go through the lens, be concentrated, and then it will hit the back of the eye, the retina. And where most of your vision is in this fovea, right in the macular part of the eye. And your eye tends to zone in if you're watching television, looking at anything. It will focus in on this area here, which has a high concentration of cells. And this is the basic anatomy of the eye. And what I'll be focused on is whether or not this lining here, this retina, can give us clues about diseases that are relevant in the context of a COVID storm. So this is really what I'm interested in. And we look at the retina all the time. It's part of, or should be part of, a routine examination whenever you see a doctor, certainly when you see an eye doctor. And this is generally the picture as to what it looks like. And critically, you can see with regards to the retina, the blood vessels here. These are branches of the retinal artery. This here is the optic disc. This is where the optic nerve comes into the eye on either side. This here is the fovea, where the macula is, where the high concentration of most of what you see is. It tends to look a little bit darker. And this is a normal retina that you have that we use to be able to see. And as I said, when it comes to looking at this, this is something that happens very often, oftentimes in the context of routine examinations. And this is the OCT. And this is one of the tests that they will use to look in quite a lot of detail at the retina. And my question is whether or not this test has a relevance with regards to picking up symptoms or signs of disease even before people recognize it. Because one of the problems is that for a lot of people, this is silent. They have no real symptoms, kind of like what happens with hypertension. Hypertension is silent as well. But if you leave it alone, it can do huge damage to the body. This is what optical coherence tomography looks like. And it takes a very detailed picture of the back of the eye. And you can see the blood vessels are very highlighted. It's looking in detail at the retina and the nerve cells. And it can do lots of remarkable things, especially now that we're moving into days of artificial intelligence. So this test, I think, has great potential to be able to guide us in terms of what could be happening. So let's give you some insights into a bit more detail as to what I am trying to figure out. Now, in truth, this is not easy to work out because if you don't set the settings on the test right, you won't find the right results. So we need to be able to figure out what are we looking for. Here is a picture of the retina again. And remember, as I said, this is where the light comes in. So this is on the inside of the eye, and this is towards the outside of the eye. And this is just a section through this part of the eye. So the light literally passes through the optic nerve layer, going through these inner layers all the way down to the very back where it hits the pigment epithelium. And then this light registers on these rods and cones, and this is how you see. So the light has to pass through here in order to trigger a response for you to be able to see anything. The important thing that I'm highlighting here is the fact that the blood vessel on the top here and the blood vessels down here are, this is the choroid plexus of the retina, and on the surface where you saw the retinal arteries, in between here is very protected. So there is a retinal, a blood retinal barrier, just like there's a blood brain barrier. And so these cells are very protected from anything else that's happening in the body. And so my question is, if we are having damage, like what could be happening in the brain for some people, to this protective layer, will we be able to pick it up when we look at OCT in detail at each of the layers? Because OCT is able to focus on every single layer separately and give us answers. And when you combine that with artificial intelligence, that could be really, really powerful. And again, I've got here an image as to the difference between a normal retina. So this is the top here, and you can see the nice clean blood vessels going along here. This here is the macula where you tend to focus the light. This is the optic disc where the nerve comes in. And down here in the lower half, they show what happens in diabetes. So in diabetes, we know to monitor this because we can identify characteristics that can increase the risk of blindness. And so very often people who are diabetic will have their scans every year to look at all of these patterns and to hopefully try and manage them before they can lead to blindness. So it's not far off that we're doing this, or I'm suggesting this. This is already being done. I am saying, in the context of a COVID storm, where we need to figure out who could be at risk, being able to do this kind of sophisticated investigation could be absolutely critical. When we think about one of the most common diseases, age related macular degeneration, AMD, this here is just giving you an idea as to, if you remember, right at the bottom here of where the light has passed through everything and then it hits the retinal pigment epithelium. These are important cells for maintaining the health of the photoreceptors, and it feeds them. But in macular degeneration, they get damaged, and so therefore they can't support them well, and you have problems with the vision, and people can go blind. And you can see here, this is looking at the mitochondria in these cells are damaged and not as effective as they should be. And the point being is that these retinal pigment cells are right on top of the choroid. And what I am suspecting is happening is that there is autoimmune damage at the top with the retinal arteries and at the bottom with regards to the choroid arteries. So here is what I'm saying is that based on autoimmunity, because there is a high concentration of ACE2, so if you were targeting that by autoantibodies or CD8 cells, you could then end up with damage to this part of the eye. Similarly, at the top, if you had an autoimmune process, you could have damage breaking down this very protected part of the retina. High probability that we'd be able to see the patterns if we were looking for them. This is the point that I'm making. More than ever, we need solutions. We need ways to find answers that would help us to identify who could be affected in the context of this COVID storm. And I'm just going to remind you in terms of the numbers, just so that you have them here. This is what it looks like. When we look at these numbers here, and I'll come back to that in a second, I'll just make sure that you can see the full size of it. But when we look at those numbers, we can see that there is a specific cohort that is at very high risk for mortality after COVID infection. We're talking about 12% in the over 65-year-old group. And actually, it's even higher if they haven't been boosted. But this is all in almost fully vaccinated people, fitting in with what I anticipated, that if you have recurring infection, recurring exposure to spike protein on the back of vaccine immune priming, the principle of the COVID storm, we can then see very serious conditions occurring. These are challenging times, and what I'm saying is very, very inconvenient for people who have been following a narrative. But I've been saying the same thing now for 5 years. We have got to look carefully at the science, acknowledge where errors have been made, and try and mitigate them. It is not acceptable what is happening now, where there is a continuing ignoring of these issues. Can't happen. There are too many lives at risk. And if this continues at this rate, this could have very serious consequences for the population. As I said before, just a reminder, if you've come in late, remember that we are also looking at the spike detox. Does everyone need one? Webinar coming up. Look in the description below to join us as we try and see if we can explain the science around what is happening. This spike protein is a beast. The more that people are exposed to it, the higher the risks. We've got to find ways to mitigate it. Have a great evening.